Rush hour looking very fluid and empty right now. A sign Bay Area residents taking this lockdown seriously. So when will we know the worst has come? Well, KPIX5's Wilson Walker joins us now with that. Wilson?
Everything we know from our epidemiologists and our experts tells us that in a matter of days, we will have serious constraints on the provision of medical services to those who need help.
San Jose Mayor Sam Liccardo says it is just days away, the moment the crisis really starts to unfold in our hospitals. It is a disaster that, for now, can be hard to see coming, even though it has already upended our lives.
So people's sacrifice and compliance with this tough advice is hard because they can't see the impact right now. But they got to trust us. If you're skeptical and don't see the impact in your community, look at Italy.
Basically, we're a couple weeks behind Italy. So by that approach, one would say you're going to start to see a substantial uptick in the coming 2 to 3 weeks.
Art Reingold is an infectious disease expert at UC Berkeley. He says Italy and the United States are on similar trajectories as far as the math goes, but our lack of testing means there are a lot of things we do not know.
So it certainly is plausible that extrapolating from Italy is not quite right, and that one could begin to see a substantial bump next week, so I wouldn't rule that out.
There are, however, some factors that may work to our advantage. The steps we are all taking to distance ourselves will undoubtedly slow the spread.
When can we prove to you how many lives we saved? It'll be comparative math after the fact.
That is because the effectiveness of social distancing is as hard to predict as the current spread of the virus. Just about every part of this equation is a variable.
I know it's frustrating, but we know that this is spreading and it's going to surge and it's increasing exponentially. You got to take our word for it.
All right, you just heard the governor speaking right before we came on. He mentioned the fact that they might need as many as 19,000 additional hospital beds to care for the sick. So how are they coming up with that number? Well, they're figuring, you heard him say, about a 50% infection rate in California, which is pretty high. Estimates run from 30 up to about 70, so 50 would be pretty high. You figure 18% of those people need hospitalization. That is the surge we are talking about. When will it happen? As you heard, maybe over the next couple of weeks. But the social distancing that we are all trying, that is how we're going to bring this swell down, bring the necessity for additional health care services down. But all of these numbers keep moving. The effectiveness of what we are trying to do one another, that is still to be seen. The spread of the virus is still to be seen. So all of these numbers are a little flexible. What you're hearing is the government preparing for possible scenarios. It is important to remember that all of these numbers are changing, and where we end up is really an open question right now. We're all trying to figure it out, and as you can tell, so are the people who are leading this effort. We are live in Walnut Creek. Wilson Walker, KPIX 5.